Hello, everyone. I'm Dr. Gentian Huti. I'm the Chief of Department of Anesthesia and Intensive Care at the American Hospital 3 in Tirana, Albania. And today we're going to talk about tocilizumab, which is one of the most important drugs which has been used recently to treat the patients with COVID-19. As you see with these pandemics, we have encountered a series of controversies regarding the treatment of the patient because it was a great challenge with an unknown disease, which eventually led to unknown protocols of treatment. We haven't had the, let's say, enough time to develop proper protocols, and we haven't had enough time to study as it should this disease to derive proper protocols. However, we know that this disease is involving multiple organs, and eventually it's causing a burnout of human resources throughout the world, even in the big hospitals. There are some still debated points about the treatment of COVID-19 patients because, as we said before, it's an unknown disease with unknown proper pathophysiology. So we are not even sure after 2 years when, why, and how to give any specific drug like tocilizumab or remdesivir or anakinra. And added to that, we are still not sure how to ventilate these patients when they are needing, let's say, very high amounts of oxygen. So should we ventilate these patients with continuous positive airway pressure or standard intubation and so on? So let's talk about tocilizumab, which, as you all know, it's an interleukin-6 inhibitor, which is included in the monoclonal anticorps class and was recently used for the treatment of rheumatoid arthritis. As you all know, it reduces inflammation and it's used for blocking the cytokine storm in COVID-19 patients. And its method of administration is divided in 2 doses, 8 milligrams per kilogram, given 8 to 12 hours apart. Well, there was, and there is still a list of researchers and studies about the effect of tocilizumab and its use in COVID-19 patients, and one of those is published in the British Medical Journal in 2021, which included 150 patients of COVID-19, and they were divided into groups which had tocilizumab in their treatment and with standard therapy. And the conclusions of this study was that tocilizumab was not superior, and if given not properly and not with the proper indication, it even may cause increased mortality at some specific patients. Another thing that we should take in consideration is the broad list of side effects that tocilizumab may cause to a patient. So the debate about its benefit or its use in COVID-19 patients is still open to this day. In another article in New England Journal of Medicine 2021, they studied 389 patients and they were divided in 2 groups. 249 used tocilizumab and the other 128 with standard therapy. And during this study, the clinical progression, mechanical ventilation, the need for mechanical ventilation, the mortality and the side effects were evaluated. And they saw that tocilizumab reduced the likelihood of progression to the composite outcome of mechanical ventilation or death. But in general, it did not improve the survival of patients. Here we see a more detailed explanation of what we talked about. In another study, which was published in Lancet in 2020, 444 patients were enrolled and divided in 2 groups with tocilizumab and standard therapy. And in the standard group, 16% needed mechanical ventilation, and in the group who used tocilizumab, this percentage was 18. So the mortality seemed to be equal in both groups, approximately 7%. And but that's a interesting detail, that the new infections in the group using tocilizumab was 13, whereas at the standard group, at those patients who received standard therapy, it was only 4%. Well, the National Institute of Health and the Infectious Disease Society of America have given some recommendations regarding the use of tocilizumab, and they have stated that there are insufficient data to recommend for or against the use of tocilizumab for the treatment of COVID patients who are within 24 hours of ICU admission and who require invasive or non-invasive mechanical ventilation or high-flow oxygen. However, some of the panel members would administer a single dose in addition to dexamethasone in this setting. So the patient who do not require ICU care or who are admitted to the ICU but do not meet the above oxygen requirement, the guidelines recommended generally against the use of tocilizumab, except in a clinical trial, because the even though the Infectious Disease Society of America guidelines recommended against the use of the interleukin-6 receptor monoclonal antibodies such as tocilizumab for the treatment of COVID. This was because most probably the use of tocilizumab made those patients more prone to developing very serious infections, sepsis and septic shock after the use of tocilizumab, after the inhibition of interleukin-6. Another of the treatment, another of the researchers and studies that has been ongoing regarding the COVID-19 treatment guidelines. They made a statement on the February 3, 2021, and they have determined that the patients who are within 24 hours of admission to the ICU and who require invasive or non-invasive mechanical ventilation or high-flow oxygen, for these patients, there are insufficient data to recommend either for or against the use of tocilizumab or any other interleukin inhibitor for the treatment of COVID-19. So another of the studies that has been going on these last 2 years is the IMPACTA trial, who studied 389 patients not requiring mechanical ventilation or non-invasive mechanical ventilation. They were divided in two groups with a ratio of 2:1 tocilizumab and standard group, and they saw that the tocilizumab group has a more smaller progression toward the mechanical ventilation with regard to the standard group, but the mortality on the 28th day was equal in both groups. One of the other trials who has studied tocilizumab is the COVACTA trial with 452 patients. 61% of them required mechanical ventilation, but it was seen no big difference between the groups, standard and tocilizumab. Boston area COVID-19 consortium tocilizumab trial has studied 243 patients with no significant differences between the groups regarding the intubation time and mortality rate. Another trial studied the efficacy of tocilizumab in COVID-19 patients. The Boston area COVID-19 consortium and the Corimuna-19 tocilizumab, and the trials did not identify a mortality benefit from tocilizumab in these patients with moderate or severe COVID-19 who did not require organ support. Well, if we are to make some comments based on our experience and on literature, we may say that the efficacy of tocilizumab is still very debatable. The riskiest scenarios are the septic complications of the tocilizumab use, which we have observed even in our clinical practice every day. So the physicians are not always sure to exclude the secondary bacterial infections. One of the problems is that interleukin-6 measurements are costly and need some time to get a result. And at the other hand, we have dexamethasone, which is a certified treatment as an inflammation modulator. So when we see the literature, there are controversies on tocilizumab's criteria. In the use in COVID-19 patients. So the CDC task force does not support the routine use of tocilizumab at all. They just recommend it for some specific patients, and its routine use. It's not for the moment. It's not in the protocols. Thank you very much for your time and have a good day.